Heparin and warfarin. It's very important in AMC exam. Let's start by management of hemorrhage or high INR induced by warfarin. So here we will divide the patient into two categories. The first one, if there is no bleeding, and the second one is if there is bleeding. I mean active bleeding. The first one, if there is no bleeding, the next step is checking the INR of the patient. If the INR between 4.5 to 10, then the next step is skip the next dose of warfarin, or reduce the dose, or even stop it. So that would depend on patient condition. Suppose that there is no bleeding here. But in case of INR more than 10, so the next step is giving the patient vitamin K immediately, along with stopping warfarin. So please differentiate between these two. If the INR 4.5 to 10, then skip or reduce or stop it. But in case of INR more than 10, then stop warfarin and give the patient vitamin K immediately. The second scenario is that if there is bleeding. How I know that there is bleeding from the case scenario? The case scenario we're talking about first, decreased blood pressure, I mean hypertension. And the second thing you will notice is that there is a brain hemorrhage. I mean intracranial hemorrhage, obvious by the CT scan. So that's indicate active bleeding. So the next step here, whatever the INR, I don't care of the INR here. The next step here is following this step. Stop warfarin, give vitamin K to the patient, along with fresh frozen plasma or prothrombin concentrate. The most important step, the most vital step here is fresh frozen plasma or prothrombin concentrate, because these will provide the patient with the coagulation factor and it will cause immediate stopping of the bleeding. So if I want to choose between these three steps, I would choose the most important one is the 3. And if I want to choose between fresh frozen plasma or prothrombin concentrate will be better. But it's usually, expensive and not available. And if you note it's in the case scenario or in the MCQ, then you should choose prothrombin concentrate because it's better and it has less side effect. Now, how to deal with low INR? Suppose the patient has a condition and this needs a target INR of 2 to 3, for example, and the current INR of the patient is 1 or 1.5, so it's below the normal. How to deal with that? To deal with that, the next step is increase the dose by 1 milligram each time. Suppose that the patient is taking 5 milligram or warfarin, so met x6 and then check the level again of the INR after maybe 1 week. So increase the dose by 1 milligram each time. For full course, please contact us through amcqbook@gmail.com. Thanks and goodbye.